Hi there. How can I help you today?
I have an appointment with Dr. Hartman.
Oh, okay, yeah, just fill this out for me, and here is a pen, and I'll be right back.
Thank you.
Matos? Ready for Alex Matos?
Yeah, that's me.
Come on in.
All right.
After you. Just have a seat up here on the table, and Jane will come in and take your blood glucose here in a second, okay? And I'll be right back checking on you.
All right. Thank you.
Hi, Alex.
Hey, how are you?
How are you doing today?
Doing well.
Nice to see you again.
Good to see
So
you.
we're just here for a checkup, is that right?
That's right.
And maybe doing some monitoring on your blood glucose.
Yeah,
Changing
the
some
nurse.
things there.
The nurse said the blood glucose was a little high.
Okay. Well, do you have your home testing
I
with
do.
you?
Yeah, right here.
Perfect. Let's take a look at these. Okay. Yeah, these do look a little bit high. Now I know last time we talked a little bit about cutting out the soda and the fast food from your diet and maybe trying to make some changes with your exercise and things like that. How's that going for you?
Well, I have cut out the fast food quite a bit. I'm eating a little healthier. But
That's
when I
great.
do eat fast food, I don't usually upgrade to a large like I used to.
That's good.
So that's going a lot better.
Good. I'm glad to hear that. And how about the walking plan that we had you on? How's that
I've
working?
been walking a lot with my dog. I just got this new puppy. And,
Aw, sweet. Yeah. Okay, so you've been doing those things, correct?
Yeah, right.
Okay, great. Well, I'm really proud of you for doing that. Unfortunately, you know, the levels are still pretty high, so sometimes those aren't, they're not going to work as well as we want them to right away, so we're going to maybe start you on a medication to help lower those blood glucose levels.
Okay.
It's called Metformin, and we're going to do twice a day with meals. And actually, Nurse Jacob will come back in, and he's going to set you up at a patient computer, and we'll get you started on a video to kind of introduce you to the medication. How's that sound?
That sounds great.
All right, thank you. We'll see you back in a week.
All right.
Thanks.
All right, Alex, just have a seat right here for me. We have a short video so I can explain the disease a little bit for you. So after it's over, if you have any questions, feel free to give us a call, okay? Dr. Hartman's going to see you again in about a week, okay? So just have a look.
When trying to take charge of your diabetes, metformin is usually the first-line drug to help lower your blood glucose.
Metformin is the generic name for Fortamet or glucophage and is a biguanide, which is a class of anti-hyperglycemic drugs used for type 1 and type 2 diabetes.
Metformin was the first one in its class with the unique biguanide structure, as you can see behind me, and it's currently the only biguanide on the market.
Right now, your pancreas produces insulin, but it cannot get sugar into the cells of the body where it normally makes energy. Metformin helps lower your blood glucose where it is too high and restores it to its correct form. Metformin can decrease glucose production by the liver by over 1/3. In addition, it can decrease intestinal absorption of glucose while increasing its peripheral uptake in the cells. This improves insulin sensitivity, or how your body reacts to what little insulin it's still producing.
Metformin comes in a tablet form that can either be immediate release of 500, 850, or 1,000 milligrams, or extended release of 500, 750, and 1,000 milligrams. It is not metabolized or altered through your body and leaves the body unchanged through the kidneys to your urine. It normally starts working anywhere from 2 days to 2 weeks. Your doctor may have talked to you about your lab results and what they mean for your overall health. Let's do a recap on how metformin can change those.
Your HbA1c value shows an average level of blood sugar over the past 3 months. This can show how well your diabetes is being controlled. According to the American Diabetes Association, the target goal for your HbA1c is less than 7%. To be diagnosed with diabetes, your HbA1c must be higher than 7%, but metformin can lower this up to 2%. Metformin can also lower your fasting blood glucose levels by 50 to 60 milligrams per deciliter. Metformin can also have a good effect on your triglycerides, or fat in the blood, and total cholesterol, by lowering them up to 20% and 10%.
Thanks for watching our video on metformin. If you have any additional questions, talk to your doctor or your pharmacist today.
How was that video?
Oh, so informative.
Awesome. Do you have any questions for us?
Not right now.
All right, so we're going to see you back in a week to follow up Dr. Hartman, okay?
All right. Hey, I'm here to pick up a new prescription. Last name is Matos.
Alrighty, looks like I have one for you. Is that metformin?
Oh.
Yeah. Are you familiar with it at all?
I'm a little familiar with it, but it's new to me. So can you tell me a little more about it?
Yeah, it's the first non-insulin drug used for type 2 diabetes, and it's used for those that are turning older. Obviously, you're older than 10, so you're fine. You use it to treat your high blood sugar. I'm sure your doctor talked to you about that. And it's actually the first drug that doesn't cause hypoglycemia. So that's keeping you from getting your blood sugar too low.
Okay.
Did your doctor talk to you at all about diet?
Just a little bit about the staying away from fast food and stuff like that.
Yeah, okay, so when you're taking this, you want to make sure that you're eating those complex carbs. So that's fruits, veggies, whole grains. And when you take this medicine, you're going to take it with meals at the same time every day. So if you take it with dinner, stay with dinner, always with food.
Okay.
Now side effects, you're going to have some nausea, vomiting, and diarrhea, but those will probably go away over time. Most people adjust. Most people stay on it long term, but some people get tolerance, but you should be fine to take it for a long period. Now there is a really rare side effect called lactic acidosis, and that's something you need to be looking out for. So you're talking about fast heartbeat, shortness of breath, stuff like that, anything that's really out of the norm. If you just feel really different, really bad, I would let someone know.
Okay.
Any questions?
No, it's a lot of information. Thank you.
Sorry, have a great day.